This portion of Local Lifestyles is brought to you by UVet.
I'm back at UVet with Dr. Jimmy Yu, and today we're going to make things a little chilly, aren't we?
Yes, we are.
Cryosurgery. So what are we talking about?
Yeah, so cryosurgery or cryotherapy, basically we are using the very cold agent we call cryogen, apply on the skin tissue, especially if there's a specific lump or a mass. We know this on the skin lesion, and this is a really good tool to, help with that.
And so does it hurt the pet? How does it feel?
Well, every one of them will feel the cold, chilling, effect. Most of them, they don't care. It just, sometimes the gas coming out, the sound, the cryogen, it kind of scares them a little bit. And usually, with the owner, sometimes even pets, we have some protective gear to help them out. And so it's kind of fairly safe to, everyone involved. And we usually do in the exam room, like here with the owner present. There are rare cases that we really need to do a nerve block to, block lesion a little bit, especially if they are, a little bit bigger size. Otherwise, it's pretty straightforward. And
you're really pleased with the results of this on these specific injuries or lesions?
Yeah, if those lesions, we think it's appropriate that, and the size is, of course, there's a limitation of the size. They need to be small per se, and the size is really based on every veterinarian, their preference, something like that. To me, it's about a centimeter per se. But, if it's bigger than that, we do have other means to help with that. But when those lumps or bumps you notice on your pets, they are, fairly small, and just notice they are really good tool, without general anesthesia and in a really, short period of time. And we could do this in the exam room and get that taken care of. And they are very, wide effective, pretty, could treat a variety of different mass.
Can you show us how it all works?
Absolutely. So I have the boiled egg here, and you can see I put a stop down there, and so that's the area we pretend that's the lesion we are going to treat. Now I'm putting this applicator on here, and excuse me with a lot of sound. And you can see that, there's a cryogen on the surface. If there's a lump, basically they will be, cover the whole lump area, and that, and usually there's a period of time that then kind of chill the tissue a little bit. And usually about 10 days, 2 weeks, if not all of them, some of them will feel off. And usually it's painless procedure.
Well, that's what I think is impressive, is it's non-invasive and basically painless and effective.
Yeah, and it's been done on human patient by, dermatologists. They have a lot of experience. In veterinary medicine, of course, this is something, it's going to be utilized more and more. And that offer a very good alternative for not just its, newly found mass, but also for pets if they had, owner concern about put them under. This is something we could try first.
Always great, and learn something every time I come to see you, Dr. Yu. We'll be back with more lifestyles right after this. Stay with us.
This portion of Local Lifestyles is brought to you by UVet.